In this morning's Health Watch, school nurses. When many of us were growing up, there was always one on the school premises. But with the budget cutbacks now in many districts, that's no longer the case. One family says that's what led to their tragedy, as CBS's Priya David Clemens reports.
In Tacoma, Washington, 10-year-old Mercedes Mears took the bus to school with her sister every day. But the ride on October 7th, 2008, would become her last.
She left for school at about 8:05, 8:06 in the morning. She was fine. Next thing I knew, I got a phone call from the school. Mercedes had an asthma attack, and we called the EMTs.
The family says even though the school had a plan of action and an EpiPen in case of emergency, Mercedes didn't get her medication or even CPR. School officials did call an ambulance, but it was too late. Mercedes died in a hospital that morning.
No one attempted CPR. No one put her care plan, nothing.
Due to cutbacks, there were only 11 full-time nurses to cover more than 18,000 students in the Bethel School District. This isn't just a problem in Washington state. Nationwide, there's no standard for school health care.
If you live in Vermont, you have one school nurse to just over 300 students. If you live in Michigan, you have one school nurse to just under 5,000 students. So there is a great range of what children are receiving in the United States for school health services.
And as schools suffer budget cuts, school nurses are becoming scarce.
Well, it's not a shortage of nurses, it's a shortage of funded positions. School districts need to make that a priority and need to have a funded position available for a school nurse to be in the building.
Mercedes School acknowledges that they could use more funding and more help.
Certainly, I think every school district could use more nurses. Oftentimes, it's a matter of funding and then also finding personnel to staff those positions.
Jeanette Mears says the lack of a school nurse not only contributed to Mercedes' death, but also killed the heartbeat of her family.
The damage is done. It's done. And I don't see it as being repairable.
Priya David Clemens, CBS News, Tacoma, Washington.
The Mears family has filed a lawsuit against the district seeking $15 million in damages. Joining us now from Washington is Amy Garcia of the American Nurses Association. Ms. Garcia, good morning to you. Good to have you with us.
Good morning to you.
We see a case like Mercedes Mears right there, and it's obviously a case met with tragic consequences there. On a national scale, how often are we seeing things like this happening with the shortage of nurses out there in schools?
You know, it happens way too often. Parents should be able to send their child to school and know they'll come home unharmed or actually come home. And on the shortage of nurses, I would say that in schools, it's a shortage of funded positions for nurses. There's typically not a problem filling them when there is a funded position.
So this is basically, you're saying the school districts need to appropriate more funds so you can have nurses on hand at the schools. I just want to throw one number out there. As of 2010, more than 50% of public schools across the U.S. do not have a full-time registered nurse. 25% of schools have no nurse at all. Now, you think it's a financial thing. Why isn't it getting more attention, though? Why are school districts not doing more?
You know what's fascinating to me is that parents in Vermont have prioritized this, and parents in other places have not necessarily raised their voices. In the state of Washington, where Mercedes and her family lived, there was one nurse per roughly 2,031 kids. It's just egregious. And parents should be asking, is there a nurse in my school? Will there be somebody to take care? Because what happens is schools say, well, it's not a big deal. Our school secretary or a paraeducator can do this. But there is value in actually being a registered nurse, because registered nurses know how to assess the kids, plan for their care, how to treat, and how to respond in an emergency.
Yeah, all right. Amy Garcia, thank you very much for taking the time. We do appreciate you speaking with us this morning.
Thank you very much.
All right.